those 3 points. And my technician now simply waxes up the undersurface of all the lower teeth to that new occlusal plane. And that new occlusal plane has a curve of Spey, Wilson and Monson of approximately 4 inches radius. So as you can see, I've now built up my lower occlusal plane to the ideal shape, our average anatomy, and now it's simply going to the upper and bringing the upper teeth down to the lower. How do we start with that? We start again with the lip, and we do exactly the same thing. How much incisal edge of the upper tooth should a man of, say, 45 to 50 show? And the average is about 1/2 to 3/4 of a millimeter. So I'm going to do the same thing here. I'm going to measure with my perio probe. Underneath the upper lip, find out where his tooth is. Measure that distance from his incisal edge to the upper lip, and then add 3/4 of a millimeter on. That will now allow me to wax up the upper anterior teeth to the correct length. They may not be in contact yet. So once I've waxed up the correct buccal aspects and the length, I'm then going to add wax onto the palatal aspect to bring the palatal aspects down to the incisal edges of my lowers. And by doing that, I can accomplish my wax up. The last part of it is to wax up the upper posteriors and bring those down to the lowers. And there's my finished wax up. Now, ladies and gentlemen, this is the most difficult part you've done. Okay, this is the treatment planning. This is you using your expertise, your knowledge to work out the best way of planning to go and restore IVA. Everything else is now carpentry. Everything else is drilling teeth under guidance. So from this diagnostic wax up, we take templates, I have preparation guides, I have my prototypes made, and all I simply do now is use the preparation guides to prep the teeth. And I then put my prototypes on. We do it in sections. I do the upper anteriors and lower anteriors first. I'll then do the right-hand side and then do the left-hand side. We'll then review. We'll review to make sure I've got my 5 principles of occlusion into those prototypes. And then if I have, and we ask our patient, we make sure our patient is comfortable, there's no problems with the joints, etc. He can talk, he likes the appearance. We then switch from prototypes to our definitives. And again, we do that with our custom-made incisal guidance table. The end result is that we've got IVA looking a little bit dowdy, a little bit full in the face, not looking particularly well one side, and we've got a younger looking IVA. Teeth are looking a little bit nicer, smile's looking better, the colour of his skin has improved, he looks a little bit thinner in the face. That could be the fact we've increased his vertical dimension. It could also be the fact that he's just a bit healthier looking after his diet now. But we've made a huge impact on him, his persona.